This mini-lecture on health in health and safety is one of a group of lectures provided for the London South Bank University's Occupational Health Nursing degree programme. Hello, I'm Jo Kitney and a visiting teaching fellow at the London South Bank University. The subject of ensuring health in health and safety is large, and so I've actually split this across two mini-lectures and information sheets. This video is part 2, which looks at the more practical side of how to fit health into health and safety and business management. The first video of health in health and safety focused on explaining what health in health and safety means and the importance of goal setting to lay down what will be managed by an organisation or business. You can download the information sheet that accompanies this mini-lecture from the Kitney Occupational Health and Safety website, www.kitney.com. In part 1 of this mini-lecture, we put some understanding around what health in health and safety is and the importance of goal setting for an organisation or business in order to establish the basis for what that business wants to manage and to act as a reference point for decision making on actions and budgets and services. Having agreed on goals, the next step is to work out what is needed to achieve these and to put arrangements in place. So, for an example, if an organisation decides that it only wants to meet legal obligations for health, then the scope of its health in health and safety arrangements will be limited by what is required by law. However, if an organisation decides that it wants to go beyond compliance and raise the level of health and fitness for its workers, then the arrangements for health will be much more comprehensive and tailored to suit the workforce and their work activities. There are a number of ways to approach the practical side of putting health into health and safety, and in this video I'll run through 7 main steps to doing that. These steps provide a good base for building up a profile of the health needs of the organisation, for making some informed decisions and for checking on outcomes. The 7 steps are on the slide here, and you can see that number 1 is to understand the goals of the organisation, which was covered in our first video. If the organisation doesn't know its goals, then it's worth establishing these, and the information from the following steps can help with this. Step 2 is to develop an understanding of health needs, which is building a health profile for that organisation. It involves establishing what health hazards staff may be exposed to, who may be harmed, and how. You can see an example of this on the slide here, which is laid out as a health hazard risk register and lists the health hazards typically found at work. These may be biological hazards, chemicals, fatigue, manual handling, noise, shift work. It's also important to establish what the health or fitness requirements are for the organisation. So are there any jobs where a particular standard of fitness is required for work? An example of this might be good hearing, eyesight and colour vision to work airside at an airport, fitness standards for driving heavy good vehicles, or the health requirements for working in a hospital. A further health need to bear in mind is whether the organisation wants to go beyond health hazards and fitness for role into employees generally having a good level of health and fitness to help reduce risk of injury and sickness absence. Step 3 is to review the organisation's current arrangements for health at work and undertake some form of gap analysis between health needs and what is currently in place. This analysis will look at both how health and safety is structured and managed and whether the particular requirements for health are accounted for or not. The analysis will help you understand what actions are needed to ensure there is health in health and safety management within that workplace. On the slide here, you can see a very simple business health check that lists some of the main areas that may need to be managed for health. And this health check is also included on the information sheet that accompanies this mini lecture. Step 4 is to agree how and where health arrangements will fit within the business. This might be a part of its existing health and safety management, it might be a separate health management provision, and importantly, it's how it links across other parts of the business. So health absolutely needs to link to areas such as HR or human resources, training, risk, procurement and legal. On the slide here, you can see some of the typical areas where health can be weaved into health and safety management. The list that you can see is taken from OSAS 18001, Occupational Health and Safety Management Systems. This is not to say that a management system has to have this framework or these elements, it's just that they provide a very good base to work from. Generally speaking, in any health and safety management system, there'll be sections that talk very specifically to health, for example, pre-employment health screening, health surveillance, sickness absence management. In addition to this, there are other elements into which health should be included. So, for example, ensuring there are targets for health management, such as the numbers of health monitoring completed or training provided. Health and safety roles and responsibility statements should reference actions needed to manage health as well as safety. Resourcing should include health programs as well as safety costs. Risk management should include health risks as well as safety. You can see that simply by broadening safety into health and safety, most elements of any health and safety management system should have a reference to health. Step 5 is to put the health into health and safety by agreeing or confirming plans with management and, where needed, with their workers, and then by updating the documents and the resources within the company. As a general rule, there's a hierarchy of documents within any organisation, as demonstrated on the slide here. There's generally a health and safety policy and other company policies which lay down expectations for management. From this, there will be standards, procedures, work instructions, forms and templates. Health documents, or documents that also include health, will sit at all levels of this hierarchy, and it's important to identify what documents are needed where. You can do this by having a document register or matrix, which lists the elements of a management system and what documents are located within it. You can see an example of this on the slide. A cross-check of what is in place and what is needed will then tell you how much work is involved in putting the health into health and safety. Generally speaking, it's easier to update the documents from top to bottom, as each layer of the documents defines what is needed in the next layer down. It's really important that documents refer to each other as well as other parts of the business. Step 6 is to put the process in place for rolling out health and safety, or the health in the health and safety, and to put the arrangements in place that you've developed. Depending on the size and scale of the change, this might be relatively straightforward, and a simple update for staff may be sufficient before any arrangements can then go in place. Where there's more significant changes, or there's been significant updates to policies, procedures, standards, or in fact the whole management system, then a communication and change management plan is likely to be needed, just to ensure that managers and staff are aware of what is happening. The final step in the process is to check how things are going. There are some that would paint the picture of successfully putting in place health and safety as looking like this. However, my experience is that success looks a little bit more like this. Doing any form of health or health and safety management is not always an easy journey. There will be times when it falls over and you need to take 2 steps back before you're actually able to go forward. But with good planning, being flexible, listening to what people are saying, and changing the approach where needed, health management can move forward and be put in place. So health and safety isn't always easy, and it is a case of going the journey, but it's often through these journeys that organisations and practitioners get their best learnings. This mini tutorial is coming to a close, but before it ends, I would just like to touch on the employment cycle from an occupational health perspective. So in terms of the employment cycle, there are 5 main parts. You can see these on the slide here as being recruitment and selection, on starting, during employment, on leaving, and after employment. Now, managing health at work has a role in each of these steps. For recruitment and selection, it's about helping the organisation to select people who are fit for work, and where they are not, helping them to guide on how this can be managed so that an employment decision can be made. It may also be about checking health before somebody is exposed to health hazards, whether this be noise or some other form of perhaps respiratory sensitizer. This establishes a baseline of health for future health assessments. On induction, it's important new staff are provided with information about how the organisation manages health at work, the health hazards and risks they may be exposed to, and the actions they should take in order to take control of these. During employment, there may be a reason to complete health surveillance or fitness checks, manage injury or ill health, do workstation assessments or other activities for managing health at work. These may be required by law or decided on by the organisation so that it can manage its health risks. On leaving employment, there may be good reason to check on a person's health status, such as doing an exit health surveillance, and after employment, health records must be managed. So when health is managed well at work, it will manage the health of workers across the entire journey of their employment. Health and safety needs to cover the health needs of the organisation at each and every step of the way. So this draws us to the end of this mini lecture, which we've looked at how to ensure the health and safety. We've looked at the 7 main steps to ensure the right decisions are made, the right documents are in place, and health arrangements are rolled out and monitored. A cross-tech check to ensure that these arrangements cover the employment cycle, as well as the hazards, risks and business needs, should ensure that the health needs of the organisations are met. Thank you for taking the time to listen, and the information sheet that goes with this mini lecture can be downloaded from www.kitney.com.